Hi, my name is Yamilet and I will be doing my skills video on the intramuscular injection. I have gathered my supplies here. I have my patient, I have my medication, my gloves, my alcohol pads, some gauze. I have my syringe, which is a 3 milliliter, and I also have my needle. Typically for these injections, we want to use a 22 to 25 gauge 1 to 1.5 inch needle. I also have my sharps container here on the side. The first thing we're going to do is we're going to check the healthcare provider's orders, and that reads morphine 6 milligrams intramuscular 1 dose, which is, after doing our calculations, 1.5 milliliters. We're also going to do the 6 rights of medication administration, which is the right patient, the right drug, the right dose, the right time, the right route, and the right documentation. Once we have done all of that, we are ready to approach the patient. We're going to enter the room and close the door behind us for privacy and introduce ourselves to the patient. Hi, Mr. Smith. My name is Yamilet, and I will be your nurse for today. Can I have you state your full name and your date of birth? We're going to check that against the wristband to make sure we have the correct patient. And now we're going to ask the patient if they have any allergies to medications. All right, Mr. Smith, do you have any allergies to medication, food, or environmental allergies? No? Great. And before getting our medication ready, we're just going to explain to the patient what is going to be done today, and answer any questions or concerns that they may have. Okay, Mr. Smith, so your doctor has ordered you to have an intramuscular injection, which means this medication will be injected directly into the muscle, where it is absorbed in the bloodstream. This medication relieves pain. It acts on those pain receptors to help you relieve pain. Some common side effects are going to be mild redness, some bruising or swelling. Some adverse effects, which is something we don't want to happen, is a rash or hives, difficulty breathing, or severe dizziness. If you do experience any of these symptoms, please notify me immediately. Normally, if there is any allergic reaction, we would be able to tell 15 to 30 minutes after the medication has been administered. And just like any other injection, you will feel some slight burning or stinging sensation at the injection site. Where we're going to do this medication, where we're going to inject the medication, is in the ventral gluteal site. So I'm going to have you lay on your side once I tell you, so your hip can be exposed. Do you have any questions before we get started? No? Okay. And then just want to confirm the dose is going to be 1.5 milliliters of morphine sulfate, which is what the doctor has ordered. If the patient doesn't have any more questions, we're going to go ahead and perform hand hygiene. And I'm going to put on a clean pair of gloves on. Okay, so now that we have our gloves on, the first thing we're going to do is we're going to open up our syringe here. And we're going to open up our needle that we'll be using. Perfect. So we have our needle here. We're just going to place it down for the moment. I'm going to uncap the morphine sulfate. I'm going to grab an alcohol pad. I'm going to open up the alcohol pad, and I'm going to clean the top of the vial. Okay, we're going to let that air dry, and in the meantime, we're going to draw up 1.5 milliliters of air into the syringe. Perfect. Going to remove the cap. We're going to inject this into the vial. We're going to inject the air into the vial, and we're going to invert and then draw up the 1.5 milliliters of medication. And just want to make sure there's no air bubbles. Okay. Make sure we get rid of those air bubbles. Okay, and then we're going to go ahead and cap the needle using the one-hand scoop. We're going to set this down, and now we're going to have the patient lie on their side with their hip exposed. Our injection site is going to be the ventral gluteal site. So what we're going to do is we're going to put the palm of our hand down at the greater trochanter, and our thumb is going to point towards the patient's groin, and then our pointer finger is going to be to the anterior superior iliac spine, and then our middle finger is going to point towards the iliac crest. So it's going to form this V here, which is going to be our injection site there. So once we have located our injection site, we can actually put a alcohol pad on there. Okay. So we're actually going to put an alcohol pad there just so it can indicate where our injection site will be. Once we have located that, we're going to assess the skin for any discoloration, any swelling, bruising. We're also going to just make sure the muscle is good for us to use it as an injection site. So we're going to kind of just make sure the muscle mass is good. We're going to palpate for any tenderness, or any pain. Once we have confirmed everything is good for us to use as the injection site, we're just going to grab another alcohol pad. And then we're going to clean outward about 2 inches from the injection site. Okay. And then we're going to let that air dry. The way we're going to do the injection is we're going to place our ulnar side of the hand down at the muscle here, and then just kind of stretch out the skin here. And then with our dominant hand, we're going to go at a 90-degree angle. Okay, so once we've done that, it is air dried. We're going to remove the cap. Going to place my hand there and then spread out the skin. We're going to hold our needle like a dart, and we are going to inject the medication nice and slowly. So what we would do is we would stabilize it, and then we want to push back for about 5 to 10 seconds to see if there's any blood. 5 to 10 seconds have passed. There is no blood into the syringe, so we can go ahead and inject the medication. We're going to go at the rate of 10 seconds per milliliter. Perfect. We're going to grab our gauze. We're going to gently just remove the needle. Without recapping it, we're going to throw it in the sharps container. We're not going to apply too much pressure on there. And then we're going to go ahead and answer any of the patient's questions. We're going to go ahead and document on the patient's chart the medication, what amount was given, what dose, the medication, what dose, the route, the time. We're going to see if the patient has any questions, see how the patient reacted to the medication. We would put the call light within reach, and then we would answer any questions and then check on them in a little bit to make sure there is no allergic reaction going on.